We're going to turn now to our GMA Health Alert and new research here that reveals 3 things to avoid in middle age that could substantially reduce your risk of developing dementia. And our medical correspondent, Dr. Darien Sutton, is right here with all of this. And you both know I have a history of dementia in my family, and so I'm very concerned about this. What does this study say?
Well, the big takeaway from this study is that there are changes that you can make and how you treat your health in your 40s and your 50s that can benefit your brain decades later. This recent study is coming from the journal The American Academy of Neurology, and researchers followed over 10,000 adults for nearly 3 decades to look how key health risk factors in their midlife, including high blood pressure, diabetes, as well as whether or not they smoked, translated to their risk of dementia. More specifically, they looked at how many more years did people live without dementia. For adults without these 3 risk factors, they lived on average 30 more years without dementia.
Wow.
For adults with all 3 risk factors, high blood pressure, diabetes, and those who smoked, they lived on average 17 and a half years without dementia.
That's a big gap.
That's a 12 and a half year difference. It really underscores the significant deep connection between our heart health and our brain health.
What's interesting to me about this study, too, is it speaks about the idea of health span versus lifespan.
Yes.
Tell us more about that.
And which one is more important?
Right.
Lifespan is how many years you live, and health span is how many more years do you live, or how many years do you live healthy and independent. That's what the goal of this study is, understanding how we can get to a point where we're independent and healthy. Independence, and that is obviously the key here, making sure that you can take care of yourself.
When I looked at those risk factors, my grandparents who had dementia both had diabetes and high blood pressure, so it's unbelievable. So how do we reduce those risk factors? This
is a conversation I'm having with patients often, because in the emergency room, I'm often seeing the end results of untreated conditions that are often preventable. So we can start with high blood pressure. Number one, knowing your numbers. A healthy average for healthy people is 120/80. That top number is when your heart squeezes. That bottom number is when your heart relaxes. You want to have a goal of getting toward that. And sodium here is a real big factor. 90% of Americans eat more than the recommended amount of daily sodium. That's about 2,300 milligrams, and it's not from salty food. It's mostly from packaged and processed foods. As for diabetes, knowing your numbers as well, checking your blood test called an A1C, and increasing your fiber. We talk a lot about protein, but fiber helps to slow your digestion. It also makes you more sensitive to the insulin that you produce. That keeps your blood sugar low and reduces your risk of diabetes. And then, of course, quitting smoking, remembering that it is an addiction. So if you need help, talking to your provider about nicotine replacement therapy.
As far as the study goes, did they find any other factors that impact the risk of dementia?
And that was the interesting part here. They found factors that differed in terms of gender, race, as well as genetic risks. Women were more likely to live without dementia despite their health risks. Black Americans were more likely to develop dementia compared to white Americans, but authors also pointed out that there's a lot of social factors that are at play here, like access to care. And then there's a genetic risk factor. Those who had a genetic factor called apolipoprotein E4, ApoE4, it's a blood test, were shown to have an increased risk of dementia. We've known that, but it's not a diagnosis. So when you get this blood test, if you have that result, working on those other modifiable factors can help to reduce your risk.
It is just so fascinating, so important. Thank you so much, Dr. Darien.
Of course.
Appreciate it.